collection canvas will start now, and we have the same quorum we had earlier. So Donna?
Okay, the Canvas Board did complete the process of tabulation, so we have a final result. Everybody should have a copy of that here at the table. I will tell you that the program did not separate provisional votes, so those we did separate out, so you could see those.
Okay.
So they were listed in the early advance mail column. So we do have the turnout was at 73.72%. That's fantastic for Ellis County. That's the highest I've ever seen. So I think that's great. I will mention also, because I know Ellis City has been very interested in their council. They had 3 member positions. And of course, Martin Labarge was on the ballot and Jolene Neuenberger, and they had votes to carry them on. But Kelly Kronovic received the most as a write-in. She campaigned as a write-in, so she will be the one. So we'll review those write-ins. We just didn't get that done today.
Sure.
So, and we'll bring those to you next time.
Sounds
Thank
good.
you.
Commissioners, do you have any questions for Donna?
I do not.
No. Everything looks fine.
Any comments from anyone in the audience? Okay, I'll make a motion, we certify the election as presented by Clerk Maskus.
I'll second that motion.
We have a motion and a second. All in favor, say aye.
Aye.
Aye. Motion passes 3-0. And the meeting of the canvassing board will now adjourn.
Thank you, Donna.
The meeting of the Board of County Commissioners will now come to order. Let's stand for the Pledge of Allegiance. I pledge
Allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Donna, if you could call the roll.
Glad to. Commissioner Dean Hazelhorse,
Present.
Commission Chair Butch Slyer,
Present.
Commissioner Dustin Roth.
Present.
You have a quorum present.
Any changes to the order of business?
I have none.
Couple executive sessions, looks like.
Yes, we will end with a couple of executive sessions and one here shortly. Prior minutes, October 9th, did you guys get a chance to review those?
Yes.
I believe, yep, those came in, yeah.
Uh-huh.
Everything looked fine on that.
Okay,
They were fine.
and minutes will stand as submitted. I need a motion for the consent agenda.
I'll make a motion to approve the consent agenda items A through G.
I'll second that.
We have a motion and a second. All in favor, say aye.
Aye.
Motion passes 3-0. I'll make a motion, we go into executive session for approximately 10 minutes to discuss non-elected personnel issues. Included with the Board of Commissioners would be Counselor Jeter and Darren Myers.
I second that.
We have a motion and a second. All in favor, say aye.
Aye.
Motion passes 3-0. Okay, following our executive session, I have a brief note to read. Dear Honorable Board of Commissioners, please accept this email as my notice of resignation. I have enjoyed my time here and wish Ellis County well professionally. J.D. Cox. Do I hear a motion to accept J.D.'s resignation?
I'll make a motion to accept his resignation.
I second that.
We have a motion and a second. All in favor, say aye.
Aye.
Motion passes 3-0. Issues from persons not on the order of business. Donna?
Thank you, Chairman Schleier. First of all, I want to state, and I'm sure everybody realized because everybody received their new tax statements, and we did turn the tax roll over to the Ellis County Treasurer on November the 6th. Things did go smoothly this year, and I'm very thankful of that with the busyness of election. We are currently working on the levy sheet, so that should be coming soon. And then also, I would like the commissioners, like I've done in the past, if you would mind, if the youth in the community can decorate the 2 county trees that are north of the library this year. I will have to share that I talked to the city today because there's been a dead branch in one tree and it's really bothered me. So Jesse told me today he would take care of it. So if you're okay with that, I will let the organizations know that. Thank you.
Okay. Any other issues from persons not on the order of business? Okay, moving on, the monthly department report. Commissioners, did you have a chance to review that?
I did, yeah, no issues.
No questions.
Great. Okay. Virus update. Jason?
Good evening, Commissioners. Jason Kennedy, Ellis County Health Services Director. I'm sure you guys keep track of our numbers online. Obviously, it's not been a good 2 weeks for Ellis County. Starting November 1st, we've really seen a fairly significant increase in cases, both cases per day and really our percent of positive. As we look towards the winter months, and as we look across the world and across our nation, there's nobody that is faring well right now with the virus. So we've put out several press releases on Friday in conjunction with a bunch of other organizations. Really, we need people to make good decisions. We need individuals to make decisions to really protect themselves and others. Nothing has changed from the start of COVID with what we can do personally to combat this virus. And really, it is avoiding those mass gatherings, avoiding gatherings really of people in general, washing your hands, wearing a mask if you can't socially distance, and really just distancing yourself from others. So as we move through the winter months, we really need people to help with that and how that looks in their own personal lives. Now, the population, we talked a little bit about podcasts on Friday, and we'll start doing that weekly. We talked a little bit about this virus. It is still a new virus. It is still a novel virus, meaning that we don't have all of the data on it. However, we do know that this virus disproportionately impacts those over 65 at a higher rate. They have a higher mortality rate, significantly higher mortality rate than really anyone under the age of 65. Right now in the state of Kansas, the total overall cases in the state of Kansas from the start of the pandemic, 86.4% of the cases are under the age of 65. Yet 83.5% of the deaths are in the population over 65. That means that 13% of the overall cases account for 83% of the deaths. In Ellis County, our numbers are very similar to the statewide numbers in that 18% of our total cases are over the age of 65, and they account for 100% of our mortality in the state of Kansas, or in Ellis County. So we understand that this virus is disproportionately impacts that population. So I really just ask that anyone that has access to that population, anyone that has the ability to educate or has the ability to, give them that information, we need to educate them. We need to make sure that that message is getting out, that they really should take additional precautions. Not saying they have to shut their lives down completely. Obviously, everybody needs to continue to do things. They need to live. We're social creatures. But with holidays coming up, with Thanksgiving, I think we talked 2 weeks ago, Fauci's canceling Thanksgiving. I don't plan on doing that. However, if your gathering includes a large amount of people that come from all over the state, or a large amount of people that don't normally have interactions with each other, and it includes your elderly grandmother or someone that's at risk over the age of 65, you might want to rethink that as a family. It's your decision at that point what you do. Government cannot mandate your safety inside your own home. You need to make that decision for yourself. So as you look at that, as you look at how you gather safely, there are ways to gather somewhat safely, or safer, especially if you have a group that you normally see. If you're, if everyone's taking similar precautions in your small group, if your grandparents are taking the same precautions, they've seen your kids every week for the last 2.5 months, Thanksgiving Day probably doesn't look any different than that. But if you're bringing together large amounts of people that don't normally interact with each other, don't really know what they're doing to protect themselves, it's probably not the safest situation. So everyone needs to take the opportunity to take those individual precautions, and really look out for each other as we go through the holidays. No different than anything else. Mental health is still going to be an issue. Physical health, if I was going to stand here with a mandate, it'd be like I talked before. We need a mandate that everybody goes for a jog for 30 minutes every day, eats healthy, cuts out the pumpkin pie, and making sure that we do everything we can to keep ourselves physically well. Don't cut out the apple pie. I just hate pumpkin pies, so you can get rid of that stuff. But it's, we really do. We need to, and as we focus on the winter months, people generally make worse overall physical and mental choices. All that kind of stuff really kind of compounds with the holidays. So you throw COVID on top of already having some mental illness or just poor physical choices. We need people to make those good choices as we move through this. You guys have any specific questions for me?
Commissioners?
I
Got
really
a
don't.
couple, just about vaccines. I mean,
Sure.
we've got a couple, I guess, that are in stage 3 trials and looking pretty good. What's the possibility those are accessible to Ellis County residents by the end of the year?
So actually there are, so obviously our case numbers are a real, kind of blight in the picture of COVID right now. However, nationwide there are some optimistic pictures. One of them is the vaccine. There's actually 2 vaccines that are kind of in their end-stage trials. They've shown to really be very effective, 90% on one, 94% on another. There are some storage limitations. There's some issues that they're going to work out with that as far as how we get it out, how it's given, all that kind of stuff. But I do think that we will have an effective vaccine. And safety. Safety has been a huge thing. Everybody's worried about the safety of this vaccine. I trust these vaccines. I trust American-made vaccines. They're safe. Now, it's up to the individual to decide if that vaccine works for them or if that's something that they want to do. I highly encourage people, especially if you're in that at-risk population, to get the vaccine as soon as it's available. But I would have absolutely no problems trusting this vaccine for myself, for my family. The efficacy we'll see, and how long, what that durable immunity actually will be. That's something that we'll have to see. But the safety profile of it, I would highly trust that this is a safe vaccine. And if they say it's 90 to 94% effective and specific for COVID-19, it's definitely going to be it is definitely a bright spot in this COVID mess.
Any idea on people's immunity after being infected, and do we have any kind of data on that, and how long that kind of lasts?
Sure. Yes and no. Like everything else, most of the studies with COVID have been such a small population that we've extrapolated big findings from small individual cases. But 4.5 months, KDHE says 3 months as far as your durable immunity, or what they're willing to trust as far as an immune period, meaning that after you test positive for COVID, if you test positive again in that next 3 months and you don't really have any new symptoms or new onset of symptoms, they assume that's just ongoing infection, viral shedding. You can't recontract the virus. But we do know that there are documented cases worldwide at around 4.5 months. There's a few that maybe they think are quicker, but about 4.5 months is the last or the closest redocumented or new infection that we found. So 3 to 5 months. Now, how that works with the vaccine, I have no idea. I haven't seen anything about durable immunity with the vaccine. I do know they've talked about having to have a couple of shots, booster shots, stuff like that. That's fairly normal with vaccines. It's just figuring out what the booster, the duration that you need to give another booster or what that looks like. And I have not seen any data on that.
So the other question I have is, people's knowledge of this hasn't changed, obviously, in the last 2 weeks, but it's gotten a little colder. Maybe we're running into a little bit of fatigue in terms of people's willingness to try to combat it themselves, something that you warned us about in August, July, why we maybe didn't do a mask mandate, why we thought, hey, if we should wait and wait till things are bad enough that we need it. Now, a mask mandate would probably be relatively ineffective, considering 22,000 of our 28,000 citizens have been under one for a long time. And I just I wonder what your take is on why we're seeing the bump in numbers, besides the fact that it's cold, we're staying indoors, and if there's anything us as a board can really do about it besides what we've done from the beginning, which is try to teach people the best way to avoid it and try to keep them healthy in the meantime, so that if they get it, they can get over it.
Sure. There's a lot of compounding factors for our numbers. One of them is honestly, we just have more virus in the community. We have widespread community transmission everywhere in the state of Kansas. You've seen the numbers explode in western Kansas, numbers that went from 1 or 2 cases to now 60 to 70 cases per 1,000 or whatever. So if you look across the state, western Kansas is on fire as far as COVID goes. Ellis County, we have been a steady burn. Unfortunately, there's just not a better way to describe it, but we've had a steady amount of cases for about the last 2.5 months. We've really been between that 8 and 12 cases per day mark. November 1st, really in conjunction with everywhere else in the state of Kansas, those numbers skyrocketed. A couple of those compounding factors are pandemic fatigue. People are tired, they're over it, they are done with the fear, they're done with the mandates, they're done with all of these restrictions, they want to go back to life. Unfortunately, that is not a realistic option for right now. It just isn't. Now, can we continue life with some small changes? Absolutely. Those changes are the same that we've talked about and educated on since the start of the pandemic. We also have the holidays coming up. There is a ton of people that are going in and being tested because they want to go see grandma on Thanksgiving and they want to make sure they're safe, or they want to travel. I've heard there's airline industries that actually require you to have a test before you can get on the plane. So in an effort to get back to our normal lives, we have a wide influx of testing. We also have other viruses starting to circulate in the community. Strep is still here. We're getting close to flu season. We've also had allergy season from Milo harvest, that kind of stuff. So we have people that are symptomatic, and they're looking to figure out what that is. They're going into the doctor. And honestly, there's just a lot of COVID in Kansas, in the nation. So what that means is we can't change or influence a lot of those factors. We can't make people be tired of this. We can't make people stop. We can't make people stop having allergies or symptoms of other things. We can't, and we shouldn't, tell people not to test. We want people to go in and be tested. The factors that we can control are those personal factors, those factors that say, I will change this or I will do this to make sure that we mitigate this virus, or to make sure that I mitigate it for myself and those around me. Mandates. So I've been against mandates from the start. I still am. We can see that mandates don't work. The mandate itself doesn't work. Unfunded and unenforced mandates are literally just education. And so we've educated from the start. We've said, hey, this is what you need to do to protect yourself. Masks have unnecessarily become a politicized event for no reason. Whether they work or they don't, it is up to the individual to decide if they wear it or not. We won't truly know if they're effective unless we have 100% of the people wearing them, and we're never going to get 100% of the people wearing them. Thankfully, the CDC has changed their guidance and said, hey, the mask works to protect you now too. We've told people from the start that you're a bad person if you don't do things to protect others. And what we should have said is protect yourself. Do everything you can to protect yourself, your family, and your loved ones. And those decisions are ones that you have to make. People can't legal you into that. People can't push you into making good individual decisions because mandates, people are following them in the open public. When I go to stores, I see people with masks on. But where you get COVID is in your home, at your gatherings, in that social setting when you went out for drinks with the girls. That's when you get COVID. And because that's where you're not implementing all of the measures that we've been teaching you to do. So whether they work or don't work, that's something for politicians, lawyers, and scientists to figure out. What I will tell you is what works is you making individual choices to protect yourself and those around you.
So one last question, and it's just something that's come to my attention quite a few times in the last probably 2 weeks, and that is the idea of testing. And essentially the question I have is, how do you convince people that they should go get tested? Because right now there's such a negative incentive to testing positive for COVID-19. You know, the federal government has done as good as it can to help people like me in small businesses to combat the economic recession that would have come horribly from this, to help us to be safe. But I can't help but, say from a personal standpoint and a retailer, coming into Christmas, I always joke that Christmas is harvest time. If farmers want to know how we feel in the jewelry business, Christmas is harvest. If you told a farmer that he had 14 days he needed to stay home and wait to see if a hailstorm was coming for his good wheat crop, do you think he'd be real apt to want to do it? And basically, I mean, besides the constant saying that I need to help and protect everybody else, I know that. How do we talk people into getting tested if they're showing symptoms and not just trying to wait it out 2-3 days at home and then potentially spread this virus into the community?
Yeah, it's we have really from the start of COVID, we've, as a populace, I think, put off good medical decision making. Early on, we saw people not going to the doctor because they were afraid they were going to get COVID. We've seen people not going to the hospital because they were afraid of this or that. We now see people not testing because they view quarantine and isolation as a barrier to that good decision making, to taking that test. And so I really don't have a good answer for you, Commissioner. I don't. We just continue to educate. The best thing that people can do right now is if you're symptomatic, if you don't feel well, you can call your primary care physician and work with them to determine what your medical course of treatment is. We've allowed the science doctors on TV to tell everybody what to do with their health care when we should have let the real doctors that are in the clinics and that are in the hospitals and that are right here, boots on the ground, tell people what they need to do at their medical health. And so the faster we can get back to allowing doctors to be doctors and patients to trust that they can go to them and get that advice, I think the better we'll be all around. So, people just have to make good decisions that are for them. We're not there to fight you. We are not the quarantine police. We are not the isolation police, and we sure as heck don't want to fight anybody. Mm-hmm. We're there to help you. We're there to answer your questions as far as public health. The gals and guys in my office have just been getting destroyed by people that don't like that they're in isolation or quarantine. I'm sorry. I truly am. I get that negatively impacts your life, and I understand that. But we're not there to fight with you. We're there to help you. We're there to answer your questions. We ask that people comply with the measures for now because it's what we have. It's what we have to help with this virus, but really it comes down to people making just good decisions that look out for themselves and their loved ones.
I think being good neighbors to each other goes a long way as we fight through the end of this year. Whether that be shopping at a local small business or understanding when one of them isn't at your beck and call because they're trying to follow safety guidelines for a pandemic. So I know that that's happened all over the place amongst my peers in the small business world, and all I can tell them is I hope next year's better and to fight through. But I was running into a lot of that. Why would I ever go get tested? And I didn't really have a good answer for them either. They're all really smart people, but they're also people that owe money to people and have to live a life and have to feed their kids and pay their mortgage. So, it's hard to tell somebody how to make a decision for themselves, and that I can tell them what you would say, which is go get tested if you're symptomatic. But, I think that we should all, as small business owners, as people in the local community, do our best. If we are symptomatic, go to a doctor, because it might not be COVID and you might need to be treated for something else.
Don't miss a diagnosis because we're afraid. I guess the biggest thing with that is, people are going to make their own decision on testing or whatever. Obviously, we're going to encourage them to go get tested. We're going to encourage them to see their doctor. But at a minimum, if they're going to do nothing else, isolate yourself when you're sick.
Right.
Don't be around other people. Isolate yourself. If you're going to get tested, the minute you decide that you think you want to get tested, start isolating yourself now. If you have been tested, stay in isolation until you get your results. If you're sick and you don't feel compelled to test, stay in isolation while you're sick. If we can get people to make good health choices, like with the same thing we would ask them with flu or anything else, it will help. And so it's, we're at a point now where we understand this virus, we understand what it does. We need people to make good decisions on their own. Don't wait around for the government to do it for you. You make a good decision that impacts yourself and those around you.
Well said.
Commissioner, any questions?
Did a good job. Thank you again, Jason.
All right.
Thanks,
I do
Jason.
have one other thing, sort of COVID related. I don't know where Darren went, but haven't necessarily talked this over with him yet, but it's short notice. I would like to ask that you guys control the hours for business offices, all that kind of stuff. We kind of have to request that through you. With COVID at the health department, we have ups and downs. We have days where volume is high. We're going to have issues. We can see them coming in the future. I would like for you guys' blessing to work with Darren on if we need to close our lobby hours. The health department will still be open. We'll still be there for phone calls, things like that. We just might have to have some days where we're not serving clients in the office. I can't tell you what days those are going to be. I don't know what that looks like. So if I could have some flexibility there to work with Darren, make sure that we make appropriate notification to the public. We'll put it out via Facebook and press release that we're going to be closed these days or whatever. If you guys are okay with that, I would appreciate that leniency, at least until we get through this.
I think that's a reasonable request.
Oh, yeah.
Yep. As much as you need, Jason. Yep.
Okay. Appreciate it.
Okay, take
Thanks,
care,
Jason.
Jason. Hang in there.
Stay safe.
Okay, next is Community Corrections Update. John?
I'm Director Tremblay. I'm retiring after 27 plus years in December of 28th, and not really here to tell you that as much as I am. I want to introduce the new director.
Hi, I'm Erin Geist. Been with Community Corrections for almost 14 years now as a parole officer and an intensive supervision officer, and excited for the challenge and have some really big shoes to fill behind me. So it's really nice to meet all of you.
Too.
I will say, Commissioners, I'm on the group that got to hire Aaron, and it was a competitive cycle. I think they interviewed a few people and came to us with the recommendation for Aaron, and I'm excited for Mr. Trimley to get some time off. I think he's worked his butt off in his career, and not necessarily the job that a whole lot of people would be willing to take. So, but go ahead and continue. I think you guys got some issues for us here.
I appreciate you saying that. Some of the stuff, I just kind of want to inform you of what's going on with the program. We started doing parole back in 1993. There's 30 community correction agencies in the state of Kansas. Northwest Kansas Community Corrections is the only corrections agency that also does parole. I can't tell you really in words how much of a public safety advantage that is for Ellis County to have a parole officer in our own county. It's just a big asset to the citizens. It's a big asset to law enforcement. Before we did it, they were just having people drive from Great Bend once a week to come up here. So that will continue. Kyle Bartling has been with us for 13 years or 11 years. He is the designated parole officer. He's also he's one of the designated drug court officers. Our corrections program over the years has been one of the most intensive, if not the most intensive correction program in the state when it comes to contacts and surveillance and increased drug testing. I know per population, there's nobody drug test offenders like we do. It's something that I always believed in, and I know that won't change underneath Aaron. We started the methamphetamine treatment program clear back in 2002. There was no programs hardly in the nation at that time, and I've been contracting with the Smoky Hill Foundation. Now, it'll be 19 years we've had that program in January. It has a methamphetamine-specific treatment counselor, and only people with a meth addiction are in that program. They're tested before every group session, tested another day during the week. Then they receive random surveillance. It's nothing for those guys to be drug tested 12 to 16 times a month. I wrote the grant to keep that going and received the grant. So, that program was started first in Ellis County. And right now, just because of money and everything, Ellis County is the only place that we have that program. We started our cognitive behavior program well over 10 years ago. Contract with the Director of Education and the Assistant Director of Education from Colby Community College. They provide the cognitive behavior program. The cognitive behavior program is also a component of the Ellis County Drug Court. They're required to complete it. The people that are in the methamphetamine treatment program that are part of the drug court, the people in drug court are required to do the methamphetamine treatment program also. And then Judge Brown really noticed the need for budgeting classes, for drug court. So a couple years ago, Aaron came up with an idea for me to see if we'd be interested in starting a budgeting financial program. So that was started. Also with the Colby Community College Education Director. So that's going. And all those programs are funded for the next year. I never do a very good job letting people know what I do and what I accomplished. And so probably should have been telling you guys that Ellis County was the first of a lot of things, but I just always felt uncomfortable about it. About 10 years ago, the Kansas Attorney General's office came and spoke to me and asked me if I'd be interested in starting a Kansas Attorney General Certified Batterers Intervention Program. So I said, for sure, we got money, and of course nobody had money. So I started looking around and found a grant that would fund it. During that time, they passed a law that if you had a domestic violence tag, you had to go to a certified batterers intervention program. The problem was there wasn't any around, even close to our area. So wrote the grant, got the grant. At that time, Tom Runge was with me, and so we started the first certified batterers intervention program in the state of Kansas for corrections, parole, excuse me, and facilities. Was started in Ellis County. It has just been a tremendous program. The thing about the program is, and I do all the grant writing, do all the everything I can for the program, but only about 25% of the batterers in the program are on corrections and parole. So Ellis County Court Services uses it a lot. Ellis County Attorney's Offices uses it a lot for diversions. So there's more people in that program that are not with us than are with us, which is fine with me. The grant came out again. I wrote the grant again. It is just a very good program. So I do expect to see the funding with that. I talked to you about the Colby Education Department doing our COG work, and they also do our BIP. So that's Colby Community College really supported it. We extended the program to Colby. So having the same facilitators that do such a good job for you, that are respected so much, is why we do that the way that we do it. The bond pretrial program, I know Mr. Drees has been here for years giving you numbers and how many people and the cost and all that. Who knows how much money that saved Ellis County taxpayers over the year. All you can do is guess, because if you're figuring $40 a day, that it saves the jail and the sheriff's department's budget for the jail. You would have to know how many actual days, you know, that they would have been in jail. So, you know, it's anybody's guess, you know. But to say over the years that program has saved hundreds of thousands of dollars, if not $1 million, because we've been doing it now for 2021 will be our 17th year. I feel like is a real conservative estimate, and that wasn't the intent anyway. It was never to say, hey, look at us, we're saving the county this much money. The intent was to help the sheriff's department, help the judges, help the court system, and to have a program that was fully funded by them. You know, there's no money put into that program by anybody. That program fully supports itself by them paying for the bond services. I know we're planning on continuing to do that for the county when I leave. It's just right now, the virus has had an impact on everything and has had an impact on the number of people on bond. But before the virus, we consistently would have anywhere between 35 and 60 bond offenders on supervision every day. So I know, that's not going to change. I did want to kind of clear up to you about, just so you knew about oral drug testing that we've been talking about. Oral drug testing's been around for years. Never liked it because A, it was very expensive. B, at that time, you could only test for 1 to 2 drugs. That's changed now, but it's very, very, very expensive. And the other thing about oral drug testing is the detection time's only 3 days, where urine's 7. So to do the same amount of drug testing, you have to do twice as many oral drug tests. Once the virus hit, we all got together and we had to change the way we did everything. And one of my concerns was the way we drug test. We wanted to keep on doing surveillance for the program because it's an important part of the drug court. It's an important part of our agency. So our surveillance officers, they're not allowed to go in the house anymore and observe tests. So what we do, let them know we're there. They come out. We give them an oral drug test so we don't have to handle any urine, and then we leave. It's the same way at the corrections office. They come in. We can slide the oral drug test through the glass. They can handle the oral drug test, so we don't have to be in such contact with them. Money-wise, we still have to do some urine. I don't like it, but we just have to be as careful as we can when we do it. But the oral drug testing has had a financial impact on us, to be honest with you. I went ahead and purchased $20,000 worth just in case. I didn't want to take a chance. What I'm worried about is what's going to be done if there's no help for that, because we're going to have to cut back on drug testing if we don't find some help. So I just wanted to clear that up about, was this virus related? It's strictly virus related. And I was just going to have Aaron just kind of show you the difference between when we do urine drug testing. Believe it or not, they like to cheat. I could sit here and tell you stories for hours about over the years. But in order to do urine drug testing and make it valid, you have to be there. You have to be in close contact with them, and you have to handle their urine. And so I wanted to try to limit that as much as possible.
So basically, with the oral test, we have the client, if it's being done at the house as surveillance, we have the client come outside of the house so that our surveillance officers are not going into their residence. The surveillance officer wears a mask and gloves, and then they give them the oral mouthpiece. They usually keep it in their mouth for anywhere from 2 to 7 minutes, get enough saliva on it, and then it goes into the testing container. So, the only contact that the surveillance officer has is basically them handing it back to them, sticking it in there. They don't ever have to touch the saliva with bare hands or anything. And then it reads instantly. So they're maybe coming outside for 10 minutes tops, and then they can go back in their residence. Just limits the surveillance officer being in the residence and trying to maintain that at least 6-foot distance.
What's the cost of one of those tests and comparative?
Oh, by the time, they're well over double.
Okay.
And the other thing that's bad about them is they're well over double to get confirmation too. because if they deny usage, which we believe it or not, we probably have a 90% admission rate, just because they understand we're not really doing drug testing to try to catch you and throw you in jail. You know, they understand we're just, we use it as a tool to try to get you help. But if they don't admit and you send it to confirmation, the lab confirmation is at least twice as much.
And you have
So
to do
when you
these on
consider
a,
the extra expense, and then you have to consider you got to do it twice as much. They're very expensive, but I don't know how else to keep them safe because, I already had a staff person test positive for the virus. Found out today that one of our Veterans Intervention Program providers just tested positive for the virus. With us doing parole, the largest majority of inmates that are released from Norton Correctional Facility, and that county's just been hit so bad. So, they're in a very high-risk situation every day. So I'm just trying to do everything I can to protect them.
And John, how many drugs does that test for?
This is a 12-panel test.
12 panel? That's a pretty good panel.
Yes.
Yeah, they used to only be 1 or 2. You can get 12 now, and which is the same as we have for urine. So they're way better than they used to be. There's no question. But like anything, when something's better, they cost more money too.
Sure.
So, but I just wanted to let you know what, I know. I just wanted to provide some more information about, is it virus related, and it absolutely is. If it wasn't virus related, I wouldn't even be thinking about trying to get some virus release from you, or I wouldn't even be thinking about doing oral drug testing, to be honest with you.
So when you do that test on the report or wherever you're at, does it tell you like instantly they're positive or negative?
Yes.
And then you,
I do one, but I'd hate to get a false negative in front of everything. No, I mean, yeah, it'll tell you right there. It's just like, that is the one thing about them now, is they're just like your urine panel. When you do urine drug testing, to be honest with you, it takes longer for them to actually provide the urine than it does the drug test. And it's the same way with this. I mean, you'll instantly know.
so if you get a positive test, and I take it you call the sheriff's department or something, or how's that work?
I can't hear no more either.
If you get a positive test, do we call the sheriff's department? That's what
Oh,
he's
God, no.
Oh, you don't? Okay.
Now, we just deal with it, to be honest with you, supervision's changed so much over the years. Like, when I started, it was like, back in the dinosaur days, it was like if you tested positive one time for marijuana, you were a public safety risk. We were going to get you off the streets, and not anymore. You have to work hard with them. You have to do more. And especially right now with the sheriff department, the jail situation with the virus, it's like, we have to even do more, And in a sense, to be honest with you, some of the changes have been good. A lot of the changes in the entire criminal justice system have been bad. There really probably isn't any sense having a community corrections program, or for that matter, a bond program, if you had a program where you said, if you use drugs twice, you're going to jail and you're going to prison, because you wouldn't have anybody on supervision. And it makes it difficult on them. Unfortunately, just for instance, with methamphetamines, there is almost a 2-to-1 higher ratio of positive methamphetamine tests than there are marijuana tests. You know, unfortunately, we still need the meth program just because of all the problems with methamphetamines. It's still a huge issue with law enforcement, and it's still a real huge issue with us. So, no, we just put up with a lot and do the best we can. You know, I trained her, and you know, I've trained everybody that's been at the organization, and I always told them, I've always said this: your second most important thing that you do as an officer is to try to rehabilitate and try to do everything you can. Your first is community safety and public safety. And that hasn't changed. It never will change. It's just how we go about it's different. But, you know, just to be honest with you, I mean, I think you probably all know this, you know. The virus has had a huge impact on county jails in this state. The virus has had a huge impact in the prisons. So it even makes their job even that much more difficult right now.
Well, we got a little good news from CARES Act funding, so hopefully we can move some money around and get you guys some help on those drug tests.
Anything would be greatly appreciated. So I just want to tell you, I feel good about.
Good. We'll give Jason a fist bump back there because he came in under budget on a couple things, so we might be able to throw some money your way.
I appreciate it.
Thanks, John.
You guys.
Thanks, John. Congratulations on your retirement.
Thank you.
Okay, moving on, it's be the county alarm system with Brian.
Good evening, Commissioners. I'm Detective Brian Shannon with the Ellis County Sheriff's Office and chairperson for the Ellis County Safety Committee. Before you tonight is something you're probably familiar with already. We came to you about this time last year about upgrading the county's panic alarm system that is in place at the Ellis County Administrative Center. Since that time, we have been in contact with a second company, which is called SecureTech Systems, and they have come up and spoken with myself. Mike Leiker was in on that meeting with his IT staff and kind of discussed their system. Both these systems are extremely similar in the working aspect of how they operate. They have remote panic buttons that can be placed at any place, really, at desks, workstations, anywhere you would like to put one. And by pressing those buttons would activate a panic alarm that then comes over the law enforcement's radio system. So it is almost an immediate response if there was a panic alarm pressed at one of our buildings. Discussion has been with the upgrade to that system. The current system that we have now that is in place at the admin center is going to be obsolete in 2023. They're not supporting that system anymore and have gone to new technology. The new technology would allow us to put panic alarms at some of the outlying buildings outside of the administrative center, such as the landfill, EMS, health department, and all of those. Have had some discussions with Darren. We were kind of in the same boat last year when Phil left, and I'd been in contact with JD over the last several weeks about getting this, and I've spoken with Darren as far as funding. Darren stated there may be some contingency funds at the end of the year here, which is what we've discussed with you in the past, to basically see where we're at budget-wise, because this is not a budgeted expense that we have put in for any upcoming budgets. I was also approached by Bill Ring. He again would like to see a system in place at the landfill and the county shop. He has indicated that he may have some funds available as well to add that system to his if we would choose to do that. In the packet that you guys got, Darren had sent you 3 separate spreadsheets, and basically what I did on those was I broke down the bid that we got from both companies into a couple different options. The first one that you got only included the administrative center and the health department. The reason that one was, when we had our last safety committee meeting, we discussed maybe prioritizing some locations if we needed to. If the commission chose to fund partially an updated system, maybe not all the locations or not. The reason we put the health department on that one was strictly COVID related. I've had calls that I've had to investigate of people calling up there and making obscene gestures or comments over the phone. I'm sure they've had upset people come in person because of the situation. So that's why we had listed just the health department on that one. We thought maybe other than the admin center, we've had incidents in this building before, but that may be a place that we would want to look at doing something because of the current situation with the COVID. The second one that you got is, includes everything except for the courthouse and the extension office. The reason I did that one and left those two off, as you may recall, we've discussed the courthouse does have a system in place. However, it is tied into our jail system. It is not an immediate response system that would come over law enforcement radio as we've got now. It's going to be a similar system that you would have on your home. Your panic alarm goes off at home. There's somebody sitting somewhere that receives that alarm and then has to contact law enforcement. That's the way that system is set up now. It would go to our jail control room. They would then have to contact law enforcement. So courthouse staff has expressed an interest in getting in on the same system that the county already has in place. And then the reason I didn't exclude the extension office in that one was when I spoke with Darren, I just wasn't sure how you guys handled funding with them compared to other departments within the county. So that was the only reason the extension office wasn't put on that second spreadsheet. And the last spreadsheet is basically an overall cost of what it would do to incorporate all of the buildings within the county shop and weed department, health department, EMS, landfill, courthouse, and extension office. So just put those in spreadsheets to maybe help explain the cost a little bit. So,
Brian, on the last spreadsheet, the total cost there was $35,300 for the Centurion product. Yes. Is there any kind of maintenance agreement on that, a yearly maintenance fee or anything?
I may be able to answer that for you, Butch. I've got some information from them here. On the quote that they sent us, and their quote was basically the same as what it was last year. They were the company that we had last year before we learned of this Secure Tech. There's nothing on there, Butch, but I can find that out and get an answer for you if there would be.
I'd like to know that too, Butch, because it seems like every time we do anything, there's always that maintenance agreement, whether it's...
That hammers you.
It does, and usually it's, it seems like it's $3,000 or $4,000 or $5,000 a year, but I would like to know that also.
Yeah, very, very good question. There may be, there's nothing on their quote here, but I can find that answer out, absolutely.
I think that'd be
question.
important to find out.
Sure.
That's exactly what I wrote at the bottom of my page is long-term cost,
Yeah.
maintenance costs to the system, and because I think that's a big question mark. Looks like we have a little bit of a bump on that Centurion system because we're over 35 buttons, but we're quite a bit over. There's no way to kind of line item a few of these out. To get
Yeah,
them.
the way their system works, the way it was explained to me is that you have to do an expansion system once you get over so many buttons for it to work with the system.
So basically, this is just internet-based? Is that kind of when they push the button, it's internet-based or not
It's
really?
basically an IP, like the one we have now, the system is in the treasurer's office, so it's located enough within where all the buttons are. They're all on that main floor, so it's just a remote receiver, just like you would push a button to turn your TV on. When you push that button, it goes directly to that receiver at the treasurer's office. Covers the admin building. Once you get to those outlying areas, rather than having to buy the expensive system, they have the modules that you can go to those, and it's basically an IP-based system to get to that location. But once you're in that location, it's just, again, a remote button. So remote button would go to that module, would then send the IP signal or the signal to the base unit at the admin center, which is where the radio would be hooked up and would broadcast that pre-recorded message.
Okay.
And there's other things on that system that we could add if we wanted to. One of the things that was on the Secure Tech that I simply took out of those spreadsheets just so we can compare apples to apples on it, they've got a system where the current system will send out a text message. So if Mike was downstairs in IT and there was something going on upstairs, he wouldn't be aware of it, but he would get that message on his phone. That was included, but there's also an option to send out a message that would pop up on a computer screen. So say there was somebody that didn't have their phone, but they're sitting there working on their computer, it would pop up. That is an extra cost per location, depending on it. So there's things that we can add to it. There's gunshot sensors. If we have an active shooter and somebody comes in and the detector that's on the wall hears a gunshot, it automatically, you don't have to wait for somebody to push a button. It would automatically send out a signal. There's water sensors. There's all kinds of things that you can add to it. But the numbers I put in front of you was basically just to get the panic alarm system up and running.
Brian, you said the system we currently have in the treasurer's office is obsolete in just a couple years?
Yeah, 2023 is what they told me.
When did we initiate that system?
To my understanding, that was put in when we moved into this building, which was 2015, I believe. They had a similar system in the courthouse that was basically operated the same as the one that was here now. Again, it was just probably an obsolete unit. I'm not for sure what prompted the purchase of that unit in 2015 and not being moved from the courthouse. But it was the same technology. It didn't have the options to run those remote facilities at that time.
Okay.
So I can get that answer for you. I'm more than willing to come back at the next meeting and answer that for you and see what direction you guys would like us to go. So.
I'm definitely interested in the project.
Okay.
And I would like to, if you could answer a couple of those questions there, why?
Yep. And if something comes up in the meantime, by all means, send me an email and I can get those answered before the next meeting.
Sure.
I will say just a couple things before you head out. I wouldn't mind it if staff, especially department heads, would at least comment. Send me an email or us three an email about the need in any given department. They're not inexpensive. So if you don't think you need one in a particular area and we're looking to put one in there, that's fine. And or even if there's obviously some on here I wonder why we should spend X amount of money to put a button in the extension office or the county shop. I think when we start talking about the landfill, that's pretty self-explanatory. We're handling cash. We're dealing a lot with the public, stuff like that. But maybe just give me a good feel for what kind of issues you think you might run into, whether it be staff. I think that could be an issue. I can see all kinds of reasons, but before we spend $2,500 per location plus $100 per button plus some maintenance and things like that, I might want to be a little more convinced that everybody's really in need of one and wanting one and thinks that it's a good idea for the future. Luckily, the contingency money is there, and I think we can make it happen for everybody. We just want to make sure that we're handling taxpayers' money right.
Sure. And I know it's been discussed at department head meetings.
Okay.
Bill and I had a discussion, and I don't know if Bill wants to come up or not now, or if he wants to.
Yeah, he discussed a
yeah,
little
but
bit with me.
that was one of the things that he would know better than I would as far as how they deal with the public. So he can probably answer his portion.
Perfect.
Of that, if you guys don't mind.
Thank you, Brian. Bill Ring, Director of Public Works. Commissioner, to respond to your question, if you take our weed department, there's one person that's there, long hours, and there's nobody else. There's not. So if somebody is upset with the price of chemicals, if they're upset that we refuse to sell chemicals because they don't have the right licensing or they can't show where they're using, Dean could better explain this, how the application process of the chemicals works and who can buy what. I can go over there as a citizen, I can buy a couple of things. As a farmer, he can go over and buy everything. So there's, and some people don't understand that. The same thing in our office. There's often times that the gal at the front desk is the only one in the office. So anyone can wander in off Old Highway 40, and I truly believe that all of our employees deserve to be safe. No matter where at the landfill the same way. We talked about that on Saturday afternoons. There's one person in the office, there's one person out pushing trash. If it's a disgruntled customer or just somebody off the street comes into that office, what do? And even with pushing a panic button, at least here, you've got the Sheriff's Department, they'll get notified, Hayes PD, Highway Patrol, Fort Hays State. You're going to have an officer here within minutes. How long do you get an officer out there? How long do you get an officer to respond to my shop. I mean, that's, and there's a lot more involved in this, but I mean, I think you can't look at it just at the true cost. We have to offer the same level of protection for all of our staff.
Yeah, I mean, I'm going to push back on you a little bit on that. I mean, there's definitely different risk levels to the people who work in Ellis County. And so I can understand, you know, a situation happening at any given of those places. How long has Ellis County been Ellis County? I mean, so we also got to look at the long term of what are the odds and what are the taxpayers willing to pay for. I agree everybody deserves the same amount of safety, but there's probably more safety in dealing on a road grader or in terms of dealing with the general public at the county shop as there is when you're dealing with people while they're paying their taxes. Or
I would
like
beg to
said-
differ. I've had, if you would like to come to the shop someday and hear what we put up with from people that don't think we're doing a good enough job on the road,
Well,
And then-
that's all I need to hear from you, Bill. You just need to send it to me in an email. But
Okay.
you also need to understand that I'm looking at it from a long-term perspective of how many incidents has we had. It might be somebody mad about their road. It doesn't mean they're going to shoot you. It doesn't mean they're going to cause any problems besides coming in and giving a grievance about the road. And it hasn't happened in your career, has it?
no, it hasn't happened anywhere in the county in
Yeah.
175 years or whatever.
Right.
But does that make it right? I don't believe so.
Well, I'm just saying that we have to be
department
fair to all.
handles-
When we start talking about bulletproof glass upstairs and we think that's ridiculous, we got to think about all departments and where the taxpayer is willing to spend money on a panic button. It might be cheap in terms of the long term of what we're doing, and that's all I want us to do is be able to take a look at it from an outside perspective. You know,
And Brian, too, check the longevity, see if they think it's a 5-year program, a 10-year. I mean,
Good
check the
point.
longevity if you would too, Brian.
Yeah, I can do that. I've had a conversation with the Response Technologies one a while back. They currently don't have anything in the works to replace this system. It's what they're saying is their state-of-the-art, but as you know, technology could change tomorrow. So, yeah, I know at this time they don't have anything in the works, but, you know, there again, if something better comes along, that's where they're gonna spend their money too. So, one other thing I wanted to add that I will get an answer for you. I don't have the environmental office downstairs included in that quote with the buttons. That was mentioned to me as well, so I will get that added to that as well. So that way, if they feel the need for one, we at least have it in there. And
as long as we have some sort of an agreement from them that they're going to maintain it for a certain amount of years, I think that would be the big factor for us. And
Okay.
you guys think it works good.
Yeah, and I will send out an email to the department heads to send you that information if they'd like.
Okay.
That sounds great.
Sounds
Thank
good.
you.
All right, thank you.
Brian.
Okay, moving on. Solid waste review of the annual plan. Vern?
Vern Reeder, landfill foreman. Before you guys, you have the Ellis County 5-year solid waste management plan. Since 2018, the Northwest Kansas Solid Waste Association was dissolved, and we do this every year. We have to update this and submit it to KDHE, and the changes to the plan that is attached for 2020 were the Solid Waste Management Committee members, current contracts, Waste Connections and Inner Circle both extended to 2026. Solid waste tons, and also the updated counties list for our household hazardous waste program, which Osborne County was added to that this year. But I'm just looking for approval of the plan, and then we'll get it submitted to the KDHE. Have any questions?
Commissioners, do you have any questions for Vern regarding the plan?
I don't, we've renewed it before and extended it out, so I don't, it's very
Yeah.
self-explanatory.
Yeah, any changes to this, Vern? I mean, just an extension out?
Just the
Osborne?
committee members, Osborne, Waste Connections, Inner Circle contracts were extended. And then
Good.
every year we have to add, how many tons of solid waste we do for construction, municipal waste.
Very
Okay.
good.
Do I hear a motion?
I move the commission approve the annual update of the Ellis County 5-year solid waste management plan.
Second?
We have a motion and a second. All in favor, say aye.
Aye.
Motion
Thank you.
passes 3-0.
Thanks, Vern.
Okay, DSNWK, local match letter. Darren?
Good evening, Commission. Darren Myers, Director of Fire and Emergency Management. Within your packet tonight's a letter the DSNWK had sent over requesting that the Commission review and approve the chair to sign. Basically states that for some of their grant programs that we will match them when an upcoming budget year. However, due to our financial principles that we use, we can't extend that offer out past the 2021 budget because that's the only thing that's approved. And just that explanation is within that letter. If the Commission Chair could sign that, and I could get it back to them.
And yeah, I believe we signed this letter in the past, too.
Pretty much every year.
Yep.
Here. Slide it, Butch.
Yeah, I think that helps, and that's fine with me.
You bet, get her done.
Yeah, I don't have any problem with it. CARES funding. Darren?
This is just a continuation on the discussion the Commission had last week in regards to a couple of the CARES programs that weren't able to successfully complete their project requests, provide the information, et cetera. With those two, and then the Commission identified that there were, with the help of JD, a handful down there at the bottom, 3, 6, about 9, looks like, different programs that were on a waiting list to receive funds. And at last week's Commission meeting, the Commission identified that there's a funding gap, and then how are we going to meet that gap without any additional funding or reducing some of those requests. So what I did to try to find that approximately $20,000 difference to be able to fund those additional projects were to use the two different programs that were no longer eligible of $37,000, and then look at our county expenditures list of projects that we have within the county that we're looking at purchasing and what's been under budget. And there were 5 different items there that I could come up with the basically exact amount of what we would be needing to cover those additional 9 projects in the amount of $56,774. I will notate, I don't know how well the Commission paid attention to the overall funding last week. It was off on that spreadsheet that you received, so it was $400 off. So the addition, that the total number here is now correct. So with the 2 that we don't fund, the reduction from county expenditures that we are already have projects out working on or completed, we could use those 2 combined to fully fund the other projects that the Commission had discussed last week.
Darren, one question. Ellis County generator, $30.28.
So when I had to get the $56,774,
Okay.
and then I reduced the 2 projects from up above, the $37,024.72, that remained that exact figure. So I just reduced that $30 to make sure we had the exact amount needed to fund those additional projects. So yeah, it's an off number, but it got us to the number that we needed. That project for the generator is, I believe, about $4,000 or $5,000 under budget. But
That's
so
what
we'll
I
have,
thought. When you seen $30, I thought I've never bought a generator for $30. I had to ask.
no, the generator project's about $24,000. I think we had 29
I thought that
budgeted for it.
Yeah,
So there's about $5,000 remaining.
I just wondered how it got cut to $30, so now, okay, I understand.
Darren, how much additional funds do you think might be available from that county, from the county reallocations?
Most of them are, I would say those are probably the biggest items left that I was comfortable taking any money from. Of course, the largest part of that project was the CAT RMS project, and that's $1.5 million, and I think we're only about $8,000 or $9,000 under budget. So
Okay.
until that's finalized, I don't really feel comfortable pulling anything from there. The only other item or line item within that has funding available is for county PPE and cleaning disinfectant kind of a line item. And I think before the end of the year, we're probably going to have to make another purchase to be able to get some more of those consumables back in, so I didn't really want to yank that line item yet, because we go through masks, we go through the disinfectants, we go through the different cleaners that we use throughout the county, and that's a source for us to be able to purchase those.
Okay.
But I would plan on giving you a better update when I have a better overall perspective of every program within the entire CARES project. 1st of December. Maybe once I get that, I can give you a call and we can have a better one-on-one meeting. Just digging into it over last week, I haven't got that far into it yet.
And Administrator Cox was supposed to send out an email or a blast on social media to see if there's any additional requests for funding from private organizations, and none were received.
I have his email, or I have access to his email. I doubt with the timing last week that happened.
Okay.
There's some emails in there that are CARES specific, and I just not went through them. Most of them are just paperwork, receipts for like loss of revenue or their purchases that they made for their previous allocation. But to my knowledge, I don't think anything was sent out.
Okay.
I didn't go through his sent files to see if anything was sent out or not.
The only reason I bring that up is, as we go through here, I look at things, obviously, we had discussions about some of the spending that involved in it. And I think about where we're catching money from, which was basically private organizations that either bowed out of it or decided, they couldn't do it because of tax liens or what have you. So, as I look at it, I guess I have a mental block, I guess you could say, in the sense that we're taking all this funding that I know now could be needed from small businesses that we wanted to kind of fund even more equitably than we were able to because of the way the process worked. Do you have any indication that they'll give us any kind of an extension as we know how this goes?
It does not sound like it. They've extended other CARES programs throughout that whole entire CARES package, but this one's specific. I know there's a lot of push to ask for the extension, but it doesn't sound like it's going to happen.
I think the lost revenue piece is probably the most important for most of these small businesses. They don't need it to capitalize on anything. They don't need it to buy. They just need it to maybe make 2020 look similar to a year that they had in 2019 or 2018. I think we should just keep that in mind. Hopefully those come through from people that are in need. But as we talk about whether or not I'd want to spend money on helping a mom and pop store in downtown Ellis or Hayes or Victoria or Shinshin, over spending $6,250 on an air study at the school, I'd probably rather help keep those businesses open. And so I don't know if they'll come to us. It's a perfectly fine thing, I guess, to spend money on it if that's all that's there. And I'm glad that we were able to find that extra funding to make sure that the community corrections get the drug tests. But I think when I think about CARES Act funding, the all-encompassing purpose of it was partially private business, and then it was schools, and then it was government agencies like Ellis County and City of Hayes, City of Ellis, City of Victoria, City of Shinshin. And I think we got all those things, bases covered. I just would hate to get this last crucial portion of funding not out to the people that are most in need of it if we're going to spend it on something that maybe we don't deem as necessary for the future in Ellis County.
And we're kind of running out of time, December 7th, right?
That's the hard part, yeah.
That's the hard part that this comes into. I would think if we would get any more,
Meeting December what?
6th, I believe.
6th?
I think
Yeah.
December 7th.
No, 7th.
We do have a special meeting next Monday, non-elected personnel meeting, just an executive session meeting if we needed to cover it. But, yeah, that's the big problem. And that might be the only thing you need to look at and maybe just shoot to us. Has anybody requested any kind of funding from the private sector and small businesses that need help getting through this? And if not, we just proceed as we have.
Yeah, it would have to be projects that would be either probably two things: a reimbursement for money they've already expended, or loss of revenue, because
Yeah.
time for them to complete any new projects is very time constraint there.
Yep, and I'd imagine loss of revenue is the only thing I would really be concerned of, because projects are pretty tough at this point to understand or
I do know that request at least got sent out. I don't know if somebody watched the commission meeting last week, but the principal at TMP did contact me and asked if there was any other funding to be available. He was going to reach out and to some of his others.
Yeah, Holy Family was wanting to, they had some things come up that they had never planned on, far as I think air purification and different things. He called me and I told him to call you.
Yeah, and I'd asked them to send me some emails of what their project ideas would like to be, like what they would want to do.
Just
And I have
tight,
not
but,
received anything yet, but
Okay.
it's Monday, so it could be sometime this week.
Well, we do have that Monday meeting, so if we have to make any last-minute pivots, I think we probably could. Otherwise, I'm happy we're able to fund all these things. I just think we should think about the whole of what the CARES Act was supposed to do, and economic viability is definitely towards the top of why they were throwing that kind of money at us, so. Okay.
Do I hear a motion to approve this funding reallocation?
I move to approve using the identified project reallocation funds and the Ellis County project fund balances to be used to fund the pending projects within the Ellis CARES funds.
Second.
We have a motion and a second. All in favor, say aye.
Aye.
Motion passes 3-0. Okay. Darren, was Lisa going to visit with us, or we have an executive session?
We were not able to get a hold of Tom Drees to be able to be here tonight, so we won't be able to have that executive session with Lisa.
Did Lisa want to talk to us?
I know she can, nope.
Okay. Okay, county commission reports. Commissioner Hazelwood?
I got a regular KAC meeting coming up 2 weeks, I guess, so we're not, first week in December, but other than that, that's really all I have. Oh, and I will report on Shinshin out there, sorry. Concrete's poured, building is there, gonna start putting the building up Wednesday. They are waiting on insulation. The insulation is also supposed to show up on Wednesday, Thursday, Kyle said. If it does, potentially the building could be done by the following week.
We're good.
So basically, hopefully before Thanksgiving is their plan still, so we will see.
Commissioner Ross?
I sat on a meeting doing the hiring for our Community Corrections Board. That was a Zoom meeting. That was, it was good to hear the discussion that they had, and I think we've got a good future going forward. Obviously, it's tough when you have a guy like John around for as long as he was to make a transition to something new, and so you know, as I bow out from my seat, I imagine whoever takes over where I'm at, they're going to have to keep an eye on that and watch how they're doing. It's definitely an interesting board to be on. You learn a lot about community corrections, juvenile services, and all of Northwest Kansas. That's all I have for a report.
Okay. And I have no report, so I believe we have some executive sessions. Commissioner?
Is this the one you want to do first?
Yeah, let's do that one.
Commissioner Chair, may I make one thing before we go? Because I didn't put the county administrator report on here. I sent the commission an email today in regards to the request from the city of Hayes in regards to the plat extension of the Big Creek Estates on the east side of that. The planning commission, they're just wanting any preliminary thoughts or at least preliminary support from the county commission to move forward with the process, and just to see if there's any issues that the commission would like to address.
I know you mentioned in your email that the city said we would have to provide all the road maintenance, fire protection, as well as law protection.
Correct.
Is that currently the standard out there in that?
Correct. So this is an area basically on Reservation Road as you head east towards the old Sykes building. That's the process out there. Public Works pays and grades all the roads, and Sheriff's Office provides law enforcement, and the county fire is the fire service that's out there, and EMS provides service out there as well.
Mm-hmm. Okay. Any questions, Dean?
I have none.
Commissioner Ross, any questions?
Oh, I'm just looking over the email. I guess I guess I wonder what the issue is. I see Adam's here. I don't know if Adam wants to speak to it at all. It looks as though he's the owner developer out there as far as what you guys are doing and what the plan's going to be.
Adam Prey, I purchased that land. I don't have a map to show you, but basically where it's at, there's Clay Drive, you have Southview, and then there's a road that the county put in that goes north and south that I don't think is even named. We're projecting or proposing to put in some houses. At first, we're going to do a cul-de-sac, which is one option. We can make the street private. I did meet with Bill and Mason, and another proposal was to go kind of loop around and make a square, which you guys can see my drawings in my head. Therefore, the county would maintain it, or we can go straight south to Reservation Road. Honestly, any of the three would work for us. We're just looking for some direction. After meeting with Bill and Mason, we thought making it a county road would be most appropriate for all of us, but I guess I'm just looking for some direction, so.
I will tell you, Adam, a lot of your folks out there that have houses out there already are very concerned about this. I was getting calls left and right, how they were telling me this has all been brought before the county commission, that you'd brought it here, and I told them I'd never heard a word about it. So I had multiple calls from people very concerned about that project out there and wanted to know what was going on, and I told them all, you've never been here. I said, I know nothing about it. So I guess in the meetings you've had with them, I don't know what was exchanged, but I will tell you there's a lot of upset people out there with this. So I don't know if you've met with them lately and straightened all this out. I have no idea.
Yeah,
So,
and, you
Mr.
know,
Wellring, please come up.
and Commissioner Dean, I'll speak to that. I did meet with them on 3 different occasions. I also sent a mass email out to the group. I never mentioned I was before the commission, so I don't know where you're getting that information or who's told you that.
About 5 landowners that you've met with out there and said the county's all in favor of this, and I told them I didn't know a thing about it.
Yeah, the only thing I mentioned was I met with Curtis Dinas there at the city, and I said, from my understanding of what their recommendation is, they're recommending that it would approve their ordinance, but I didn't mention anything about the county, and obviously, this is the first I've ever been out here, so.
Good evening again, Bill Ring, Public Works Director. There's 3 things to consider right now. The first is based on previous commission guidance. You've instructed us that you really don't want us taking on any more roads. That's the first thing to consider. The second thing, which I've shared this with Councilor Jeter, and this was unearthed through a process of cleaning out some files. In March of 1975, the commission passed a resolution, and we can't find what was ever rescinded, where the commission said they don't want to take on any more roads. For the last 45 years, we shouldn't have been taking on roads. I've got a copy of it here. Be it resolved that whereas the policy regarding the grading, draining, and/or servicing of streets and alleys in any new urban or rural subdivision in Ellis County shall be done by Ellis County at no cost to landowner or developer. Therefore, the county commission resolved that from the date of this resolution, the county will no longer assume the obligation of grading, draining, and/or servicing any new urban or rural subdivision, street, or alley submitted for its approval. Signed by the commission, Harold Kraus, Eugene Schmeiler, Bernard Wassinger.
Okay.
Okay, so you have that. This is still an active document, which, again, we unearthed it. I don't know why it never came up. The third thing for your consideration, and again, I've had some conversations and a lot of email exchanges. The city is also saying that the way we do this process is flawed, and that you no longer, as a commission body, have to sign off on the plat and dedication, which is what, if you remember what we went through with the Kuhn 4 edition, you guys were never given the opportunity to sign off on it. It was filed, and then I came up in 2017 and found that you guys never did get that opportunity. Now the city is saying we're not supposed to do it that way. And I responded to them that in talking with Mr. Jeter, he would like to see where their interpretation of the law And because what they provided, I don't believe, and you can, give us your view of that. It was a 12- statute. I didn't know this was coming about tonight, so I didn't bring the folder.
Bill Jeter, County Councilor. Bill Ring and I have exchanged some emails and had some conversations, and in order to clarify, any properties that's within the 3-mile range is governed by the city's zoning regulations. And under the Kansas statutes, that is the body that approves the plat, because their zoning regulations govern that property, not the county's. Does not commit the county to make any improvements to the property. So the issue outstanding is who's going to build the roads, who's going to pay and continue to maintain the roads. Now, if the county approves the plat, then we're obligated to do that. To what extent would be within the discretion of the county commissioners. If we do not approve the plat, it can still be filed in the Register of Deeds office, but the county's not committed to expend any money for the right-of-ways.
I like how you said it there. Does that mean the city is liable in the 3-mile zone, or not really?
Not necessarily, no.
And then you have this old resolution saying you won't take on anymore.
Well,
which
that
if-
resolution, you can, I mean, the county commission back then, even though it may still be a valid resolution, has no ability to bind future commissions. So at any time, you could disregard that resolution, which you probably have on a number of occasions anyway.
But early last year, when we looked at the Blue Sky Edition south of Hayes, we were adamant about not maintaining or building any roads for them. So I don't know if our position has changed or not.
Mary Alice, she had a contractor, Joel Younger, I believe it was, Flatlander Dirt Works. He was building the roads and I think and maintaining them, I believe.
I believe so.
How that-
Well, the county's zoning regulations at one time prohibited private roads. But that was changed in anticipation of the Blue Sky.
And with the Blue Sky Edition, and that was done, as Mr. Jeter indicated, it was after the latest change, but we never got the agreement from the attorney with Blue Sky where they were going to take it over. So we accepted the plat and dedication. We already had Randall Lane, which is the going in from 183. So the question now is, do we really still have the responsibility for the new road should they ever be built? Because we never got the agreement.
I see.
That was never provided to
And
us.
this butts up right against Doug Shaw's addition out there too, correct?
Correct.
You're just taking on that property to the east and
And there's a lot to the south as
to
well.
the south,
Yes,
correct? And then you're gonna, I take it, add on to them roads, is that what you're, one's the north-south road there.
Right, what that was, I believe Shaw put the addition in '05, and then for maintenance purposes, because graders don't back up well, in 2011, he gave permission and he granted an easement on the north-south, as long as the county continues to use that and maintain it as a road. We have the right-of-way or the easement to keep that up. And like Adam said, it was never a named road, it's just, it's a way for the graders to keep moving straight and forward.
Adam would be building on the east side of that road, correct?
Correct. And then to the south of it.
So does he need an easement from Doug Shaw to do that too, or not, being that's actually
Well, that's another legal question, but I believe
road, but
the easement was granted to the county.
sure?
So as long as we maintain the north-south road, which we use for grader access, it will remain an easement. If you would choose somehow to pull us out of there, the easement would go away, which would then go back to Shaw, which now you own the property. So it's, the language in there says that it would go on to the successors. So the easement would then go back to Adam, or your legal group, whatever.
And how many total houses, Adam, are you maybe, or lots are you looking at selling out of there maybe?
Dozen?
13.
13?
Yeah.
Okay, how much am I miscounted? Only
Yeah,
counted
there's
11.
13 lots there. There's 4 on the,
Oh, yeah.
Side.
Yeah, you're, okay.
Yeah,
I went
4
to
on the
school in
west
Warren.
side.
Yeah, that sounds good. We always used our fingers and toes. Sometimes we didn't use them all. My fault. And how big is each lot approximately?
.5 acre.
Little bigger, but
Somewhat.
they're all really similar. They're going to be a little bit bigger than the existing lots, about .05 acres bigger than what's already there.
And you'll be tying on the city sewer out there, right?
Big Creek Sewer.
Or Big Creek sewer, yeah. Down there in the corner, yeah. Hmm.
Well, just like with Mary Alice, I don't like telling people what they can do with land they've bought. But I think we do need to look at the finance portion of it, the road portion, the backing up, turning around grader portion.
I just think we need to have some clarity on that road. It isn't named. So for one, it really isn't a 911 address / road if the road isn't named. So I
Right.
think we need to have clarity on,
Oh.
clarity on that before we, just to make sure Adam don't run into problems with Doug Shaw. Not that he would, but just to make sure.
And I'll give you some clarity, maybe this will help, Dean. That road that's not named, we actually are proposing to give it to the county, so it will be a road permanently. So we'll get rid of the easement, that'll be a road. The new road, should we go ahead and build all the way south the Reservation Road, would also not be an easement, it would be a road like it should be. If that's what you choose, if you wanted to go, that's Chad Sproul's land that owns Lot 2 there. I don't know if you guys have that. We can go out and get it, same thing, put a road through his lot there. That's an option. Or the original would be just keep it as a cul-de-sac. And I really don't know that I have a preference one way or another.
Adam, since I have little bitty print, you want to come up here?
Absolutely.
This one may be clearer, I
Oh,
don't know.
you got a better one over there? I need a magnifying glass. Oh, there we go. This looks a lot better. Thank you. Okay, so.
Here, we're going to have a road all the way south. That's what we're proposing right now. And we do have, that would be actually property of the county like every other road, so no more
Okay.
easements. Or we could run it this way,
Tie it back in over here.
or the original proposal, just keep it as a cul-de-sac. So I think we've got some good
This
options.
is Chad's here, right?
Yes, sir. These two Chad Sproul.
Oh, both of them. Okay, I just thought he had the north one. Okay,
He has lot 2.
Lot 2 and Lot 3, I think.
3. Yeah, 2 and 3 it looks like. The furthest south one's on the diagonal.
Yeah, okay.
Yeah, so Chad owns those two.
And so Doug Shaw is good with this also?
Yeah.
I think Mr. Jeter, before we can move forward, shouldn't we have that maybe in a, just so we know Doug is in favor, not verbal, just so it's on paper?
Contingent upon it, and I get something right.
Yeah.
I mean, I guess to cover us, I mean, I feel we should have something. I mean, Bill, and I know you've looked this all over, and I've been out there too, but you got any comments?
I have two more, not to delay this, but we don't do cul-de-sacs very well. Okay, so keep that in mind. If you look on the original plat that Doug Shaw did before they built or gave the easement, there's a cul-de-sac that's carved in there that I believe they're going to try to get removed, because the two people that are on the east end of both things, both sides of the road, have got a horseshoe of ground they really don't own. That needs to get cleared up. If they try to make it a private road on the south end where the 4 lots are, we can't do it at all, because, I mean, when you have a mid-mount blade on a grader and you're pulling in and you can't go through,
Yeah.
so how that's going to, you can't use any other piece of equipment, I mean, any kind of plow or drag bind to do that. So that's not really going to work.
The north-south would be better, I mean.
And then the other thing I'd like to bring up that came up, because we both, well, he attended via Zoom. The city has a utility meeting the first Tuesday of every month where they bring this up for discussion with all the Midwest Energies, Next Tech, Eagle, us, the gas companies, whoever, to discuss different things that are going on. And so there was quite a discussion about this. And I also asked something else. There's never been any traffic control devices brought into these equations. So right now, looking at where Adam's map is, the gentleman that lives right here, where the road comes up, he'd be in the development, he and others have asked for a stop sign. And there are no stop signs where the roads go into reservation. So everybody leaving, going onto a main county road, there's nothing to control them. So now the burden of traffic control devices is back on Ellis County. So for me to address this stop sign issue, it's the same as every other speed study or whatever. I have to hire a traffic control engineer. He's got to do a study, go through all the process, do accident reviews and different things. And then I have to come to you after spending, upwards of a few $1,000s to say, can we put a stop sign up in front of this gentleman's house? And then you all will have to choose whether to do that or not. Because all traffic control devices and speed limits, it's commission approval only. So we have that. So now if he brings that up and we go through that process, and then 6 months down the road, someone else in there says, well, how come there's no stop sign now on Reservation Road when I leave? They're going to come ask you about getting a stop sign. You're going to call me. I'm going to spend thousands. We go again.
I think if we're going to do it, we need to do it all at once.
Well, that's something that I brought up with Adam. We discussed that, is what is the future? Because we've never had a requirement to worry about traffic control devices. Because we have very few developments, and most of them have been around for a long time, where they really didn't delve into worrying about this. I worry about our road safety and making sure that we have it. But I don't have the authority. I know there should be stop signs on Reservation Road. Okay? I don't have the authority, and you need someone that has a professional engineering stamp on a document telling you that that's the right thing to do. So this will continue on as well.
So Adam, to the south there, is there a chance of future development along here or not?
No.
It's my understanding, Dean, the only way they can do that, they have to put a public lift station in. That's going to cost a significant amount of money, so
Okay.
I'm not saying it's impossible, but it wouldn't be worth it.
All the property, his development is right here. All the empty property here, the northern part is all going in the floodplain, so you can't develop that. The southern part, as well as Chad Sproul's 2 lots here and the lots that are here, cannot be developed because they have to be, per what was written up years ago with the Big Creek Sewer Improvement District, they have to go on the sewer system. There's no more room for it. After he gets his hookups, you can't, there's no way to pump
More
sewage.
capacity out there.
So
Well, no, there's plenty of capacity. You have
the pumping,
The sewer line would be out of the ground. Matter of fact, where we are, we have to put what's called a grinder pump in to get the sewage up, to get it to flow downhill. So there's plenty of capacity. It's more so it just gravity.
Yeah.
so they would need a new lift station put in to the tune of
About $250,000.
a lot of money. It's, I've heard different numbers, but it would be a large chunk of change to be able to put up, a few houses. So it'd be cost prohibitive.
Sure. Well, I think Adam's got a good plan. I mean, if there's a chance of putting in 13 more houses, I guess I would just like to make sure our county counselor signs off on this too, and he's okay with easements from all the people through there with Doug Shaw, just so we know that we're not getting into something that isn't.
Well, I think, Adam, where you are in the process now is you have not been to the city planning commission?
That's right now. So, no.
Okay.
So can we, well, I guess, I don't know, I mean, can we wait for our part of approval till we know he has everything approved and brings it back to us for Bill to review?
Well, I don't think we're really approving anything, just kind of giving a voice of okay in terms of going through the process now.
Good plan.
Because it goes to our planning commission and then comes back to us for
It
final.
goes to the city
Yeah.
planning commission.
But that's the question, is it actually going to come back to you now with what the city wants for the plat and dedication?
I guess if they approve it and it comes back to us and they've approved it, I mean, so all of a sudden we're liable for the roads even though we didn't have a say?
That's possible. See, when you look at state statute, there's different aspects of it. And there's, like, it has to do with the development, the 3-mile zone. But also, there's a whole section on roads. And when you look at road statutes, it talks much the same as the only way to get rid of a road, I can't close a road. I temporarily could close it for an emergency, but to actually vacate it, which you guys have done, the commission has to take action. So therefore, the commission, as far as I'm concerned, and the studying I've done on, your commission then has to approve a road. If you have to approve getting rid of it, you have to approve taking it on. Yet the city is saying in the 3-mile zone, you don't, but yet it's our road. It's very confusing. And then do we want to take on new roads?
Looks to me like we already have. I mean, we're grading it now, right?
We're using it as a, we're not grading it like a road might be in a housing development because there are no houses there. It's a dirt road. We use it so we can keep the grader going straight.
Sure, exactly. We're already grading in Big Creek and Doug Shaw's addition.
Right, and we have multiple problems because of the obstructions that were built up against. We have mailboxes that are as big as this podium at the edge of the road. We have people that park on the right-of-way. We can't get by, they park in the right-of-way. So we have a very hard time trying to pull a 40-foot grader that doesn't steer real easy between cars and trucks and mailboxes. So, and again, how do we control that with more housing? It's like people putting head walls up. They all put, it's against the code, but who do we have to enforce it? So we have multiple sets of head walls out there, which it clearly says you can't build head walls on a driveway entrance.
I thought in the 3 miles zone, the city would had to enforce that.
No, that's the problem. They strictly zoning.
I know. So if we had a 1 mile zone, that may eliminate some problems, huh?
Maybe even a half-mile zone.
Half-mile zone's even better. Okay. Adam, again, I think you have a good plan. I mean, it looks good. I guess we just need some clarification on some easements and right-of-ways. I mean, I like the idea you want to build potentially 13 homes out there, so that's a great plan.
Thank
All
you.
seem to be pretty nice houses out there, and I, you know, to the question I think that Bill has asked is, you know, do we want to take on more roads? I guess it's at what cost? And housing is definitely an issue in Ellis County, and so we have to make the decision at the cost of what and figure it out with our road and bridge so we can take care of them. But, you know, power to you, Adam. I think as long as we can get through these little hurdles, we can figure it out for you so you can start building houses.
Appreciate it.
Awesome. Thanks, Adam.
Okay, Dean, you want to?
Jason's, right?
Mm-hmm.
Okay. I move that the Board of County Commissioners recess into executive session under the following exemption to the Kansas Open Meetings Act pursuant to non-elected personnel matter exemption. How long? How long, Jason?
15 minutes.
15? 15, okay. Those persons to attend are the Board of County Commissioners are Jason Kennedy, Bill Jeter, County Counselor, Darren Myers, and I'm assuming the 3 commissioners.
Yeah. I second that.
We have a motion and a second. All in favor, say aye.
Aye.
Motion passes. And there's no action.
I move the Board of County Commissioners recess to executive session under the following exception to the Kansas Open Meetings Act pursuant to non-elected personnel matter exemption. Open session will resume in 20 minutes at, looks like 7:40. Those persons to attend in addition to the Board of County Commissioners are Bill Jeter and Darren Myers.
I'll second that motion. We have a motion and a second. All in favor, say aye.
Aye.
Motion passes 2-0. And the meeting will adjourn at 7:37.
Okay.
You want to read this, Dustin?
What do we got?